Hello again, everyone. I'm Patrick Wade with the Champaign County Joint Information Center, another video update to keep you informed. We've been getting some questions from people about how do we make sure that essential services like police and fire, making sure someone comes when you call 911, making sure that people in our community have enough food, things like that. How do we make sure those continue during the COVID-19 outbreak? Those are questions that are being tackled on a community-wide basis through a collaborative effort, all being addressed through the Champaign County Emergency Operations Center. Brian Brauer, who is an associate director at the Illinois Fire Service Institute, put together a really good video about how the Emergency Operations Center works, who's involved, and how they tackle those questions. So we're going to play that video for you right now.
I'm Brian Brauer, one of the managers of the Joint Champaign County, University of Illinois at Urbana-Champaign Emergency Operations Center. The Emergency Operations Center, or EOC, is a central coordination point and clearinghouse for leading our community's response to the COVID-19 pandemic. We're applying plans and methods that we usually apply to emergencies like fires, floods, and natural disasters, but on a scale and with a level of cooperation and collaboration I've not seen in my 30 years as a local responder. This crisis is unprecedented, and so is our local response. We're using the National Incident Management System, or NIMS, to organize our response. This framework is one which all local emergency responders, civic leaders, and university officials have been trained in previous years so that we have common terminology, a common framework, and a common understanding of how we respond. We're adapting the model to fit how the pandemic is impacting our community, and we are adding components as our response evolves. We are organized into 7 primary areas. The first area is the EOC Policy Group. This group is made up of local municipal leaders and university officials. Champaign County is the lead agency because this is a Champaign County level emergency. The cities of Champaign and Urbana, the U of I, Champaign-Urbana Public Health District, Carl, OSF, Promise Healthcare, local schools and school districts, Parkland College, METCAD, the local 911 center, the MTD, the United Way, and the Village of Rantoul are all directly represented on this policy group. And there are dozens of other community agencies and units of government that are included through a representative system. The second component of the EOC model is a Virtual Joint Information Center, or JIC. The JIC is the nexus for the best local information about the pandemic. They release a daily briefing every day at 4 p.m. that provides local information on the impact of COVID on our community, on the healthcare systems, on our resources, as well as tracking how many people have been exposed, how many have contracted the virus, but more importantly, how many have recovered. They'll provide updates on a daily basis as well as other need-to-know information that includes how the community needs to access social services or other resources so they can comply with the stay-at-home order. The third group is the operations group. This is also being done virtually with dozens of local responders around the community staying in contact through daily conference calls. It's led by Chief Andy Kornstrom of the Champaign Fire Department. It has representatives from the Sheriff's Department, Champaign and Urbana Police Departments, U of I and Parkland Police Departments, Rantoul Police, and all of our rural police agencies. It also has representatives from METCAD, all of the rural fire agencies, Champaign Fire, Urbana Fire, OSF Pro Ambulance, and Carl Aero Ambulance. These are the men and women who make up our front line of response into the community, addressing this challenge on top of an already busy workload. Our main goal is to make sure that we have the policies and the information to help them stay safe and serve you in the community. Our fourth group, also a virtual group, is our planning section. This is led by Chief Chuck Louse of the Urbana Fire Department. Chuck's team is looking at what our needs will be next week. What are they going to be in 2 weeks? What will they be in a month, in 2 months? What will we need when we transition back to whatever our new normal is going to be? Chuck's team is focused on the horizon, where the operations group is focused on the here and now. Our fifth group is the logistics section. This is our most complex section and one of our busiest so far. They're being led by Colin Rector from the Champaign County Emergency Management Agency. Colin's team has the primary function to acquire the resources and distribute resources that we need as directed by the operations section. His function is to support all of our frontline responders, including the police and fire agencies, as well as agencies that are first supported by the Department of Public Health, then by our Emergency Operations Center. For example, hospitals, federally qualified health centers, VA facilities, Promise Health, and extended care facilities. The logistics group also collects donations through the United Way. Some of the critical donations that our community is in need of is personal protective equipment and test kits. It's best to donate these items directly to the United Way instead of trying to give them away through Facebook, local media, or setting up your own distribution system. The sixth group is finance. It's being led by Tammy Ogden, the Champaign County Director of Finance, and her team is tracking the expenses, contributions, and reimbursements as a result of this. There's no doubt about it. This is expensive to all of us personally, organizationally, and as a community. And Tammy's team is going to make sure that our applications for state and federal aid are completed correctly, as well as connecting our community with what state and federal resources are available to help all of us and our families. The final group is the EOC management team. It's led by Sheriff Dustin Harmon. It's supported by Lieutenant Todd Short of the U of I Police Department, Captain Todd Hitt from the Champaign Fire Department and Emergency Management Agency, Jim Roberts from the Champaign-Urbana Public Health District, John Dwyer from the Champaign County Emergency Management Association, and with support from Jason Heimbaugh, the staff of the Illinois Fire Service Institute, and Illini Emergency Medical Services. This is the team that fills in the gaps between each of the 6 previous groups and helps ensure that all of the groups are communicating and that our response is operating as smoothly as possible. We've never put together a team this qualified, this coordinated, or this large. We've never run an operations center that has both the university and the county all working together, and we've never done all of this virtually. This challenge is great, but our resources in Champaign County and the University of Illinois are greater when we work together through this centralized system. We're all in this together.
All right, thank you, Brian. So you can see when we say we're all in this together, we really mean that in every sense of the phrase. A lot of good work being done through the Champaign County Emergency Operations Center. So thank you for that. And just a couple last notes as always, more information about the local response and local resources are available at champaigncountycovid19.org. And for anyone who needs assistance, help finding resources, things like that, just dial 211. 211 is a service provided by the United Way of Champaign County. You dial 211, you get hooked up with a trained specialist who can help you out with those questions. So as always, hope everyone is staying safe. Keep staying at home as much as you can. Wear a mask if you have to go out in public and make essential trips. Masks protect our entire community. So hope everyone is in good spirits. Thanks for watching, and we'll see you next time.